Hello and welcome to The Downsized. My name is Laraine Durham, and this is a channel where we talk about lots of things related to weight loss with GLP-1 medications. Today we're at the Obesity Action Coalition Your Weight Matters Conference in Orlando, Florida, and I just had the absolute pleasure of listening to Dr. Robyn Pashby speak again. This year, we heard her last year. You might have seen her interviews on our channel, and on her channel, she gave an amazing talk last year, the weight of what we carry. And so we were all very anxious and eager to hear what she was going to give to us today, and I'm almost too emotional to speak. Just want to remind everybody out there, I'm not a doctor. Dr. Pashby is a doctor, but she's not your doctor. So if you need to seek treatment for mental health or obesity treatment, please start with your local doctor. Please tell our audience who you are, what you do.
Sure. So I'm Dr. Robyn Pashby, and I'm a clinical health psychologist based in Washington, D.C. And I've been in the obesity medicine space for, more than 20 years now. And I work on the mental health implications of obesity. And that is because mental health is obviously so related to weight-related issues in general, GLP or not. And so I've been doing this work in private practice in D.C., but also I'm on several national committees and boards and other things as well.
Yeah, awesome. Mental health, we don't think about necessarily our mental health as we've been on this journey of weight loss, right? Those of us that have struggled with obesity and overweight for our whole lives, really, we struggle with our weight, but we've also struggled with the stigma, the blame, the weight of other people's
judgments
and expectations and well-meaning strangers that you mentioned.
Yes.
I'm almost overwhelmed with thoughts about it, because you put it so well in your presentation today. You really put it like a doctor would assess a clinical problem.
Yes.
Right?
Yes.
Tell us a little bit about that presentation you just gave.
So here's the thing. I think that what happens when you live with obesity is that it's really easy to blame every experience in your life on obesity.
Yes.
Right? Because that's what society does.
Right.
So you're unhappy? Well, it's because of your weight.
That. Yeah.
Right? If you're sad or depressed, it's because of that.
Right.
And I think that we have enough data to know that that's not true. Obesity is by itself really a metabolic disease. Mm-hmm. And shame, depression, anxiety, self-criticism, avoidance of healthcare, none of those symptoms live in our adipose tissue.
Right.
And so I think that it's so critically important to separate these two things. And as I talked about today, because if we don't understand what we're treating, then we're treating the wrong target.
We're treating the wrong target.
If all we're doing is trying to lose weight,
right,
to treat our obesity, that is missing the point of all of the associated issues that are actually a result of the internalized weight bias, not the obesity.
Absolutely. I've been trying to lose weight my whole life, right? I understand, I have internalized weight bias against myself, against others that struggle with obesity.
Yes.
And even after myself losing 50 pounds with the help of a GLP-1, I still struggle on the inside.
Yes.
I said to people, I'm still a fat girl on the inside.
Yes.
And how to work through that. You gave us some really great advice on how to retell our story. Tell us about that.
So I've been thinking, obviously, over the last 20 years, a lot about this, right? How do we help people heal the wounds that stigma leaves behind? And here's the important thing. Internalization of stigma isn't unique to obesity. People living with chronic mental health conditions have it. People, as one of the attendees mentioned, people living with diabetes can have it. People living with limb differences. There's just so many different ways that stigma is present in our society, and people internalize that. And so when it comes to obesity, though, I think one of the things to think about is that we have to start by taking steps to create new experiences in our lives that we have previously avoided. Because shame is often in charge. When internalized weight bias is peaked, shame is writing the story, right? And shame happens to be a powerful storyteller.
Powerful. I'm so ashamed of how I look, of how much I'm eating. I'm so ashamed.
I'm so ashamed. I mean, how many of us have gone to bed at night being ashamed of our behavior the day before, or woken up in the morning ashamed of what we did yesterday, right? With a plan to start again
I'll do better today. I'll start over today.
It's just this never-ending cycle. And as long as shame is the author, then we are not writing our own stories. We have to step into the author role. And that is challenging when we are competing with shame.
Step into the author role.
Of our own lives.
Of our own lives. It's so powerful. Like, and it's so hard at the same time.
It's so hard. One of the questions that we got asked today was, okay, how, right? Like, how do I take that first step? And I hope that this resonates with people. The first step does not have to be a huge leap, right? It doesn't mean that you have to put on a bathing suit and go to the pool at peak hour if that's something that you've struggled with your whole life. But maybe it does mean wearing short sleeves. Maybe it means wearing a tank top.
Yeah.
Maybe it means taking off your sweater when you're hot.
I never wore a tank top for the first 40 years of my life.
Right.
I didn't want to show my arms.
Right. And so it's not like you suddenly went to a topless beach, right? I mean, maybe you did. I don't know. That's for you guys to decide. But, instead, what you do is you start experimenting. Right? And as you experiment, what happens is that you get to tell new stories about that experience, right?
I wrote some of them down, some of the things. Healing doesn't happen all at once.
Right. So the best way that I could conceptualize this is that healing follows the same path that shame followed.
Oh.
It just leads us in a different direction. If you think about it, we don't have a single negative experience and internalized weight bias for the rest of our lives most often. Right? It's the chronic, repeated exposure to things over the course of time that shapes the stories we're telling ourselves, that shapes the messages that we believe, that shapes then the thing we do at the next social gathering or the next business meeting or whatever. And I think that if we could imagine healing happening along that same trajectory, that it's one step at a time and it's not going to fix everything, solve everything.
Yeah.
It's the chronic, repeated efforts to do it differently. You weren't healed the first time you wore a tank top.
No.
But hopefully 5 years from now,
Yeah.
when you're out on your next cruise, you won't think twice about wearing a tank top.
Right. And I wear them all the time. Like,
Right.
That's just something that, came to mind. Another example you gave was wearing shorts.
Right.
I hear so many people say, oh, my legs look this way or that way. I'm ashamed of the way I look. I'm ashamed of my loose skin. Right. And we have to kind of take some of that power back.
Yes. And this is why I think differentiating internalized weight bias from the disease of obesity is so important. Because the disease of obesity does not make people ashamed of their skin. The disease of obesity is a neurobehavioral, biological, metabolic condition, right? Adipose tissue, fat cells, don't give us shame. It's all the repeated exposure to bias and stigma in the world that accumulates as shame. And that has a different name. That is called internalized weight bias. And that needs a different treatment path.
I need a treatment path for my internalized weight bias.
Right? Because it's like people are just now figuring out that we need a treatment path for our obesity.
Right. Exactly.
But you can treat obesity, as you said, you can lose weight and still have internalized weight bias.
I still have it.
Because that makes sense, because if you're not treating that condition, right? If we give you a high blood pressure medication, that's great for your high blood pressure, but it doesn't do anything for your asthma.
Right.
Because they're two different conditions.
Well, and we have to treat our mental health. I take a shot every week.
Yeah.
What am I doing for my mental health? What steps am I doing weekly for my mental health?
Right.
Nothing.
Nothing. And as one of the things I say to my patients all the time is that, look, it's not like, just like the weight journey, it's not like, every week is going to be the same level of intensity, right? You're going to be, if you go on a cruise, you might eat differently than if you're at home, right? Every week is different. But as the pressure and the stigma and the damage accumulates over time, it is our job to go after treating that and managing that with fervor, right? We need to get after that, and we can. This is the thing. What I tried to convey today is that healing is possible.
I wrote that down.
Yes, it's just not a switch that flips.
I mean, and just to know that healing is possible, because in my mind, my mom's been food restricting me since I was 6 years old. I can heal from, I'm 57, like 50 years of my life. Yeah. I've been suffering from stigma and bias. And how do I even undo that one little piece at a time?
You just told me you wore a tank top.
I did. Maybe I'm...
Use that as evidence, right?
Right.
Evidence that you are branching out in your own way.
Yeah.
There's not a prescription, right? Okay. Just like with any other medical condition, it's personalization of the treatment plan that works for you. Mm-hmm. And as a psychologist, I don't say, okay, everyone with internalized weight bias, 6 sessions, and here's how we fix that.
Okay.
Right?
Because we want something.
We want that.
1, 2, 3, 4, 5.
Of course we do. Who wouldn't, right? We want that for everything in our lives.
Yes, we want the quick fix.
Yes.
How much weight can I lose in a week?
Exactly. Right. And I think the same is true. We don't want to carry these burdens.
Right.
No. But we have to consciously understand that they don't go away by themselves.
They don't go.
And they don't go away when our adipose tissue goes down.
No, absolutely not.
They are their own thing, and they deserve our attention, our care, and our treatment.
It's so powerful.
Thank you.
So powerful. I mean, it was just such an amazing, something else I wrote down was gather new experiences, like wearing a tank top, going to the beach.
Yes.
Those are things, bathing suits. How traumatic are bathing suits for everyone?
For so many people.
And it's funny. There's a pool here at the hotel, and since I've lost some weight, I bought a 2-piece bathing suit. Never worn a 2-piece bathing suit since I was 8 years old, and the swim instructor asked me what was for lunch because my tummy was poking out a little much. Talk about traumatizing, stigmatizing, shame. So I'm wearing, and I'm thinking about, here I am at an obesity conference, and I'm by myself. My husband was doing something somewhere else, and I'm at the pool by myself, and I am walking into the pool in a 2-piece bathing suit. Like, who am I, and how did I get here? Like, just
that's the new authoring
totally new
your
experience.
New story.
Yeah.
Right? And it's uncomfortable, isn't it?
It was very uncomfortable. Yeah,
yes.
It was very uncomfortable.
But this is the thing with any mental health, and many physical health conditions as well. Treating them is uncomfortable. Mm-hmm. When we've been living in avoidance,
we don't want to be uncomfortable.
Exactly. And stepping into that emotional discomfort is hard. Mm-hmm. So, whether we're talking about generalized anxiety, where someone might, avoid, I don't know, like getting on an airplane. Maybe they have fear of flying or something, right? You don't get anywhere by continuing to avoid the airplane.
Right.
Except you get a smaller life.
Oh.
Right?
Yes.
So at some point, you have to push yourself in that direction, and it's scary. But just like fear of flying has a real treatment plan and can be managed, this sort of internalization of shame and stigma that is real, meaningful, and not your fault, because society has literally dumped it in your lap, is something you can actively work on step by step by step.
Amazing. Create new meaning.
Yes.
Something else I wrote down.
Create new meaning. So many of my patients, and maybe you relate to this, have these meanings that we attach to things, like exercise is punishment.
Yes, for so long.
For so
many
long.
years. Yes.
Right? Exercise is self-care. Exercise is joy if you are doing something you love to do.
Right.
Right? No one, you like Zumba, right?
I love cardio dance. Yes.
Yes.
Love it. I love it.
Right.
And my mom used to drag me to jazzercise with her in the
Yes.
80s. And I'll be like, oh, I don't want to.
Right.
It's punishment.
Because you had a
Right.
different meaning.
Right.
Because in that circumstance, exercise was punishment.
Right.
Now, when you seek it yourself, exercise is loving yourself.
Right. It has. And now I understand, separating the exercise from the weight loss and the mental health benefits that come with the
That's it.
exercise.
Exactly.
I used to run. I used to run half marathons, 5Ks, 10Ks all the time because I had to lose weight.
Right.
And this was the only way I could keep my weight to a level that was still 30 pounds beyond a normal weight range.
Right. And if we spend our whole lives exercising for weight loss, we never get to experience the joy of movement.
Oh, that's good.
Right? Mm-hmm. And, my daughter is a swimmer and a competitive swimmer, and she's sitting right here in the background with me. And one of the things I always say to her is swim because you love it. Swim because it's movement for your body and it feels good. It has nothing to do with weight. Right? It literally doesn't. It's really about it helps your anxiety and stress level.
Yeah.
It helps your mood. It helps you feel alive and alert.
Yeah.
That's what you get from exercise.
What movements did you do as a small child when you were just doing them to have fun?
To have fun.
Bike riding, swimming, hiking, all kinds of things.
My daughter and I went to this indoor arcade, and she nearly killed me with all the games up and down and laser tag and all of this. And we both left sweating and had a great time. Right?
Yeah.
And it was real exercise. We were both sore the next day, remember?
I mean, that's so great to find, we have to change our mind, change our story, change the story that we're telling ourselves about ourselves, about exercise, about food, about stigma.
Exactly.
So important.
We have to stop letting shame be the author.
Stop letting shame be the author.
Yes.
So powerful. Oh, Dr. Pashby. I mean, you had us all in our feelings, so much.
Thank you. I was so nervous. Because I care so much about this community and about this mission and this work. And I know last year's talk was, people really loved it, and I really wanted to live up to it, but do it differently, obviously.
I mean, and just to, go back to her last year's talk, she brought this big backpack in and unpacked one thing at a time that had held her down about weight or weight-related stigma. And we all felt like somebody understood us. You understood me.
Yes.
Everybody in the rooms, she gets how I'm feeling.
Yes.
And for so many of us, we never feel like anyone understands our struggle.
Right.
And to have amazing doctors like you at this conference that understand obesity is a disease and it's not our fault.
I know. It can be mind-blowing.
I know. For sure.
Replacing blame with biology, with science, right? And mental health is a science.
Right.
I think, people sort of put mental health as a side note.
Right.
But I say at home all the time, much to my daughter's chagrin, without mental health, nothing else matters.
Wow.
Right.
Right.
You can be in great physical condition, but if you have too much anxiety to go to a friend's house, or you have too much depression to get out of bed and go to work, what's the point?
And we see so much anxiety, especially in younger people. I have 20-something daughters, age 20-something, not number 20. But, and they, talk about anxiety and fear of social interaction. And that's something I think everyone feels, but it's just being talked about so much more today.
More openly, right?
More openly.
And I think that's obviously a huge gift, because, again, if we understand what's happening, we can pursue the treatment. And there's treatment for mental health conditions.
And I've heard you say that before, and then the first thing I think of is, I'm paying so much for this medication. I'm paying so much for my doctor. How do I afford mental health treatment?
I know.
I need it. We all need it so badly.
I know.
Can I have a conversation with you every day? Can I come to your house?
I know. So, the thing is, I understand the prioritization that people go through.
Yeah.
And we all do make priorities in our lives, right? We all decide how we're going to spend our money when we have resources to use. And the truth is, mental health professionals vary so widely in their expertise and in their passions. And I think it's a little different in the mental health realm because in medicine, we get specialists, right? So if you have heart condition, you go to your cardiologist.
Right.
If you have a knee problem, you go to your orthopedist. And in psychology, you sort of go to a mental health professional. And so they're very generalized. And so finding someone who specializes in this particular thing is a challenge. I'm not going to lie. And I try to do a lot of training of mental health professionals to make that less the case. But the other thing to remember is that it doesn't have to be intense, doesn't have to be the rest of your life. It doesn't have to be weekly. There's lots of ways to do this. Personalization of care, just like our medicines, just like our medical care, is something that happens. So we have group available, group options that people can participate in at much lower entry cost. People can sometimes work with someone for a few sessions just to sort of do a little bit of a mindset check, right? Help sort things through. So thinking of mental health treatment in black and white doesn't help us any more than it does treatment for anything. We have to remember there's this whole continuum.
And where can people go? What website can people search to find a mental health professional near them?
So there are plenty of insurance directories where if you start looking through your insurance, you can find mental health professionals that take your coverage and usually are in your area. But be discerning. So I don't want you to just, I often say shopping for a mental health professional is like shopping for shoes. You don't necessarily buy the first pair you try on, right? You kind of have to know if it's a good fit for you.
Yeah.
And I think any healthcare professional that you're going to have a vulnerable relationship with should be the same. So be discerning. Don't be afraid to go through a couple people until you find someone that understands you. And then, so outside of insurance, there are other websites. The Obesity Action Coalition has a obesity care provider directory, and that does have some behavioral health, mental health professionals in that as well. And then other places as well, like Psychology Today is one. But again, be discerning because it's the Wild West out there. As you guys know, it's the Wild West in terms of medical care and psychological care. So be discerning.
Great advice.
Yes.
Great advice. Dr. Pashby, tell us about your practice and how people can find that.
So I live and practice in Washington, D.C., but due to licensing regulations, we are actually available for telehealth in 44 states around the U.S.
Oh, wow.
And to provide mental health services, our website is healthpsychologypartners.com. So that's plural, partners. And I have a team of excellent clinicians working with me who specialize in chronic obesity and mental health. And we also have a new GLP-1 coaching program available on our website that has group options and individual one-on-one coaching with nationally certified coaches. And that is a lower price point and also available in every single state, as well as Canada. So
That's fantastic.
If you're
Tell us that website again.
Sure. It's www.healthpsychologypartners.com.
Awesome. I'll have to check that out. And you guys definitely check that out, too. Thank you so much,
Thank
Dr.
you.
Pashby. It's such an honor and a privilege to get to talk to you.
Thank you.
To me, you're just a rock star in
you're
this
so
space.
sweet. Thank
And
you.
so we really appreciate all the work that you do,
Thanks.
all the work that you're doing with other clinicians, helping them help patients living with the disease of obesity.
Yes.
So
thank you
so much.
And thank you all. Thanks for joining.
Thank you. Well, don't forget to like and subscribe to The Downsized, and we'll see. Oh, you want to? Dr. Pashby's daughter. You want to introduce yourself?
Hi, I'm Lexi.
Lexi. How old are you, Lexi?
11.
11.
Yes.
Amazing.
This is my pride and joy for anyone who doesn't already know that.
Are you having fun at the convention?
Yeah.
Did you get to go swimming? Was it fun?
Yes.
I think I saw you guys yesterday when you had just come back from the pool.
Yes, exactly.
Yeah,
Exactly.
Awesome. Well, thanks, guys, out there for
you.
watching. Thank you, Dr. Pashby.
Thank you.
Thank you for bringing your mom to this amazing conference. We appreciate you spending time with us. And thanks for watching The Downsized. My name is Laraine Durham. We'll see you next time.